Let's talk of follicular phase start and luteal phase starts. What is a follicular phase start of IVF? Starting with the period is a follicular phase start. Luteal phase start is starting after ovulation. Traditionally not done, but let's look at this research. In my practice, we tend to do both depending on when the follicle count is the best. Recent research on the luteal phase start stimulation shows that it is just as safe and effective as the standard follicular phase start for IVF. In this large study that analyzed 18,062 IVF cycles from 12,442 patients across 6 US fertility centers between 2018 and 2021. What were the main outcomes? The rates of clinical pregnancy for the first embryo transfer were remarkably similar. Remember that the luteal phase start would be a frozen transfer, 68.44 for follicular phase start and 67.67 for luteal phase start. Live birth rates were equally reassuring. After all embryo transfers, the cumulative birth rate was 58.21% for follicular phase starts and 58.1% for luteal phase start with the first transfer. With more attempts, both methods reached over 88% live birth rate by the third and the fourth transfer attempt for those under 35. Age groups matter. Patients under 35 had the highest success rates, clinical pregnancy rates of 70.49% for follicular phase starts and 78.16% for luteal phase start at the first trimester. For those 35 to 39, rates were in the mid 60% range for both methods. Patient over 40 had an expected drop in success rates, but the rates were comparable for between both the protocols of 52 to 65, and I believe these were very much all genetically embryos. Egg numbers and embryo quality, average eggs retrieved, follicular phase start cycles yielded slightly more eggs in most patients, 12.61 versus 11.85 per cycle. But in paired studies, some patients had a higher yield in the luteal phase start. Oocyte maturation and fertilization rates virtually identical. Chromosomal normal euploid rates were equivalent for both approaches in all age groups across day 5 to 7 embryo development. Luteal phase start required a higher dose of FSH, around 4,350 IU compared to 3,989 IU in the follicle phase start. The duration of stimulation was very much the same. What is a key point that we have learned? There is now very good evidence coming, which means that patients and clinics can start stimulation whenever they wish to. What do? I wait for the best follicle counts change, and even if it's in a luteal phase, you can start treating in the luteal phase without compromising safety. As with limitations, as many retrospective studies, multicentric results may be influenced by patient selection, protocol variation, and subtle differences. But this gives us a reasonable amount of evidence, like many studies, that stimulating whenever the follicle count is good is more likely to yield results without any negative impact.